Good morning, everyone. And my name is Debbie Ann Anderson. I'm the Chief Operating Officer for the United Way of Greater Union County. And this morning is my distinguished honor and privilege to introduce our panelists for our discussion on the 2012 Needs Assessment for Union County, North and South Plainfield. United Way of Greater Union County consists of all the municipalities in Union County as well as North and South Plainfield. So that's why the data is also included, just as an FYI. My first panelist guest, her name is Ms. Anna Belin-Pyles. She's the superintendent of schools for the public school district. Ms. Anna Belin-Pyles is a lifelong resident of Plainfield and is a graduate of Rutgers University with a Bachelor's of Arts, also holds a Master's in Business Administration from Eastern University. In her previous position as the Plainfield Board of Education's Director of Student Intervention and Family Support Services, she was vigorously involved in the implementation of programs aimed at closing and achieving gaps, and worked closely with parents, guardians, and community members to ensure that all students have access to resources that support academic success and social, emotional, and development. She has continued this important initiative since being named the Superintendent of Schools in Plainfield. Welcome. Our next guest, I'm going to slow down because I can read fast, is Dr. Michelle DeKlyen. Dr. DeKlyen is a child clinical psychologist who has worked as a child and family therapist, preschool teacher and director, special education teacher, school psychologist, university professor, and researcher. The major focus of her work has been the well-being of children and families, especially in unmarried, foster, and adopted families. Her research has examined parenting, parents, mental illness, especially depression, and the early development of behavior and language problems. In collaboration with the National Institute of Family Success, she has consulted on the evaluation of family success centers in New Jersey. Dr. DeKlyen received her BA from Stanford University and her PhD from University of Washington. Welcome. Antonio Lopez, our next guest. He has been the Child Welfare Administrator, Supervisor, and Practitioner for over 20 years. He has worked with direct service staff in the identification of service gaps and the building of community partnerships. In 2003, Mr. Lopez joined a core team of architects drafting the New Jersey Child Welfare Reform Plan. Mr. Lopez held the position of team leader for the Division of Family and Community Partnerships, New Jersey Department of Children and Families. He was responsible to oversee the development and formation of the Patterson Community Collaborative and the County Child Welfare Planning Council in Passaic County. Mr. Lopez is currently the administrator for the Office of Family Support Services, Division of Family and Community Partnerships, New Jersey Department of Children and Families. He is responsible to oversee the statewide network of the Family Success Centers. Our next guest, Kelli Puryear. Kelli is the Assistant Director of Adolescent Services for the New Jersey Department of Children and Families. The mission of the Adolescent Services Department is to support adolescents in transition to adulthood to achieve economic self-sufficiency, independence, and engage healthy lifestyles. Prior to joining the office, she worked as Youth Build Network Incorporated, a youth development agency, as Director of Program Development. Kelli was born and raised in Essex County, where she resides. She holds a bachelor's degree in social work from Temple University, a master's degree of social work from Rutgers University, and is a doctoral candidate in the Heldrich School of Social Policy at Bendheim University. Welcome. Next, you have Dr. William Rodgers. is a professor of public policy and the chief economist at the Heldrich Center for Workforce Development at Rutgers University. He's a member of the graduate faculty of Rutgers School of Management and Labor Relations, a senior research affiliate of the National Poverty Center, University of Michigan. From November 2009 to January 2010, Dr. Rodgers served as President Obama's Department of Labor and Transition team. At the state level, he served as an acting Governor Cody's Pension Benefits Review Task Force, as well as a member of Governor Corzine's Commission on Government Efficiency and Reform. At the regional level, Dr. Rodgers is a member of the United Way of America's Regional Operating Council. Locally, he's a professor and he's also the vice chair of Montgomery Township's Planning Board and former board chair of the Somerset County's United Way. Welcome, Dr. Rodgers. Next, you have Cherron Rountree. She's currently the Deputy Director of the Department of Parks and Community Renewal. Ms. Rountree directs the Division of Planning and Community Development, including administrating the Community Development Block Grant. She administers the housing programs, including Federal Housing Assistance Payment Program, Neighborhood Stabilization Program, Home Investment Partnership Program. She manages, her department manages the economic development and transportation planning programs for the entire county. She oversees the grant and advocacy efforts on behalf of the entire county, including service as a liaison between elected officials, administration at local, state, and federal levels. Ms. Rountree has received her bachelor's degree of arts from Rutgers University and her master's degree of public administration from New York University Wagner School of Public Service. Welcome. Our next guest is Junius Scott. Junius Scott is the Child Welfare Regional Program Manager for the Children's Bureau Regional Program Division in Region 2 for the Administration on Children, Youth, and Families, ACYF, within the Administration for Children and Families. As a Child Welfare Regional Program Manager, Mr. Scott reports directly to the Associate Commissioner of the Children's Bureau. Region 2 includes New Jersey, New York, Puerto Rico, the Virgin Islands, and 8 federally recognized tribal nations. In his position, Mr. Scott provides leadership, program, technical administration, and Children's Bureau formula, entitlement, block grant, discretionary programs related to child welfare. Welcome, Mr. Scott. Last but not least, we have Dr. Renee Wilson-Simmons. Dr. Renee Wilson-Simmons is a director of the National Center for Children in Poverty, part of the MailmanSchool of Public Health at Columbia University. NCCP is one of the nation's leading public policy centers dedicated to promoting the economic security, health, and well-being of America's low-income families and children. Prior to joining Columbia University, Dr. Wilson-Simmons was at the Annie Casey Foundation in Baltimore, a philanthropic organization whose mission is to foster public policies, health service reforms, and community supports that more effectively meet the needs of vulnerable families and children. Welcome, Dr. Renee Simmons. Our first question for the panelists is, as you reviewed the data for our 2012 Needs Assessment Study in Union County, from your professional experience and area of expertise, what was the aha moment? Or what data stood out to you?
So I'd have to say that I was able to take sort of a bird's eye view because I'm not part of the county, so I know if I were, I would be looking, where's my community, where does it sit within all of the numbers, but because that wasn't my focus, I was able to think of it in terms of the way that our center looks at state and national data. And there wasn't so much an aha moment about the data as an aha moment that this is similar to the kinds of issues and challenges that we see across states and across the nation, the importance of diversity, but the challenges it brings around issues of language, the importance of early care and education, and the challenges that poor families have to meet in order to provide that kind of care. The challenges of transportation and how they link to the ability to get a job and keep a job. So I think many of the issues here are ones that states are addressing, and that we could have a map of a state and we see those same kinds of areas of concern. So I think that what this county is addressing, many other counties are addressing, and I hope that we'd learn from the kinds of, and I don't like to say best practices, but research-based kinds of practices that are showing effectiveness, as well as the kinds of partnerships, federal and state, or community and state, that we can look to find some answers.
Dr. Rodgers?
Good morning. So first I want to congratulate United Way of Greater Lincoln County and my colleagues at Rutgers on this study it is long needed and hopefully you will practice what I talk about with my United Way colleagues in Somerset County, and also the relatively newly formed United Way of New Jersey, and that is the drumbeat. That the hope of this is not just a one-off, that she will continue to take this out to the community beyond the voices here to elicit comment. I have 5 relatively tight kind of reactions to the report. One, again, I moved to New Jersey, I guess only about 8-9 years ago, and what just amazes me is the tremendous amount of diversity, economic diversity, cultural diversity, within several miles of each other, and the level of amount of inequality that we allow to persist. That is one that just continues to strike me over the head, and the maps really communicate that point. The second point here for you is that along with working as a volunteer at the local level, I also sit on the United Way Worldwide's U.S. Board of Trustees, and so several reactions with that hat on. Number one, this work also really shows us the importance of moving away from direct impact to community impact, where direct impact is the traditional approach of the United Way. And again, in this with natural disasters and other immediate problems such as a recession, we have to do direct impact. But I think the United Way's strength lies in our work we can do with community impact, and that is really getting at the root causes of poverty, root causes of why a young child is not ready to learn as effectively when they get to kindergarten or get to first grade. And so this really amplifies the importance of continuing to move to community impact. Third is that I would love to have seen, but again, with my hat on, I see it, but there's a nice link to the United Way Worldwide's national goals of the area of education, income, and health. That's just really a 3-legged stool that's very important. And then fourth, from a UWW, United Way Worldwide perspective, this work also supports the new business model that we have been promoting and trying to get our local United Ways to pursue. And that is, yes, you want to be very focused on your resources under management, resources under control, but you have to also communicate to your volunteers. You have to be an advocate, and you also have to talk with your people who will give it to you. That it's just not about what your overhead is. That it's about going to be pursuing community impact and addressing these really thorny issues. That it's about trying to move the needle in a variety of areas that may not show up right away in terms of lower overhead. And then finally, for me, I think many of us in this room, we already have had the aha moment when we see this data. This data. And so again, one of the things I always like to communicate with my colleagues is be careful on so much focus on the data, and be bold enough to establish the narrative. Establish the narrative that you want to drive your agenda, or that you want to at least lead a conversation. Because if you don't, and you just put the data out for people's consumption, you now run the risk, we run the risk of other individuals, other groups, jumping in and controlling and pushing their narrative on what they think the solutions are. And in United Way, Jim, as you know, we talked about this, we are this wonderful third party. Right? We're this wonderful third party that today we can be this community convener to lead this conversation. So that's, those are sort of 5 sort of my quick reactions to this. And I want to quickly introduce Stephanie Thoman. She's a colleague of mine, a volunteer colleague of United Way North New Jersey. Some of my comments we're going to talk about in the next question, some work that we've done that parallels, and I think that really connects to this report. So thanks for asking me to be a part of the conversation.
Any other responses? Dr. DeKlyen?
Yeah, I'd also like to congratulate the United Way for doing this, because I think the first step in solving problems is to get good information. And I'd like to set the recommendation that this should not be a one-off, that this be repeated, because I think you need to see change. I think there were 3 things that jumped out at me. The first one, as Dr. Rodgers pointed out, is what a patchwork of communities is represented here. And I think that is typical of New Jersey. I'm a West Coast person myself, and that was one of the most striking things when I first moved here. In a way, what that means is that I think the county-wide numbers are not that helpful. You really need to look at least at the township, and I'm delighted by the maps because they really point out you really need to look at neighborhoods and sub-communities in order to decide where do we need what kinds of programs, what kinds of initiatives are useful. The second thing I have to give a little background for. My very first job actually was in the War on Poverty in one of the Office of Economic Development community centers where I ran a tutorial program and some youth programs. And part of my reaction to the whole report is what's new. There's so much of this in terms of what Rutgers is suggesting. These are the things that we should do that frankly we've been saying for more years than I care to admit to. The one thing that strikes me as somewhat new is we've always known that early childhood was important, but the last 20, 30 years has resulted in just a plethora of data, of research that shows just how important and why it's important and why we need to focus so much more than we have, frankly. And the third thing is somewhat related to that. When I looked at the forum results, it struck me that early childhood does not figure largely in what the people in the forum commented as their perceived needs. And to me, as somebody who feels very passionately about early childhood, as we'll hopefully get onto later, that indicates that we have a serious educational job to do to really let the public know just why it's important, why it's so critical, just as a kind of a forecast of some other things I might say later. There are several prominent scholars, economists, who have come out essentially saying that there's no better investment that you can make. In one particular relatively new book called Investing in Kids, where Timothy Bartik makes the case that investment in early childhood gives more economic benefit than the traditional tax benefits that communities are fond of giving to businesses for moving in. The problem is you have to have a long-term view. These benefits don't come immediately, but essentially he says, these tax incentives are essentially at best zero-sum if you look widely, not just short-term in that immediate community, and arguably even negative because you're losing taxes. So you don't have the money for communities to do other things. So that would be the kind of thing.
In taking a look at the needs assessment, there were several things that were quite striking. One, I want to just start out by saying we've seen this before, and it's appearing for over 10, 20 years. The trend has been there. But in terms of the emerging communities, the expansion of communities that are at risk, I think that's very key as we do our planning for the future, is to take a look closely at those communities. I also want us to really start focusing on the root causes. We typically, when we talk about educational system, the standard is always standardized test scores, that we base the total performance of the school district on standardized test scores, but not really necessarily looking at the root causes or the other interventions and supports and the multitudes of activities that are taking place in those particular school districts. I believe that were categorized as some of the more urban-like school districts in the report. There's a great big difference in terms of educating young people when you're taking a holistic approach and you're starting as a social service agency before you can begin the process of educating children. When a typical day may involve violence that may take place in the community that spills over to the actual school setting, and you have to address that. You have to ensure that the family is cared for as well, again, before you can start the process of educating children, as well as looking at demographics and transient communities. We look at the high rate of rental properties in communities that also impacts children coming into the district and leaving. And so you don't necessarily have an analysis of the impact that a school district has made on a child. We're only beginning to start that process when we're actually looking at student growth. We're actually looking at growth patterns and how much gains have been made by individual schools or communities. And I think it's very important we focus on a holistic approach. I think it's very important that we look at that model. There's so many indicators that you have to take into consideration. My personal philosophy, and that's implemented in Plainfield, we go from zero to post-graduation. So we're really encompassing the entire child. And many of those elements are actually listed in the report. An aha moment for me was actually looking at many of the recommendations and the things that we were well on our way, and I believe that many school districts are well on their way in terms of addressing some of those kinds of needs. But how do we bring that together collectively as a county and maybe start looking at some shared service opportunities?
Thank you. Anyone else?
I just want to talk about the diversity for a second. Union and working for the County of Union and looking at some of the challenges that we face. This is the third most densely populated county in the state of New Jersey, which may be the most densely populated state in the country. So this wide range of diversity in such a small area, it poses many challenges, but it also poses many opportunities. And it's not just ethnic diversity, it's not just socioeconomic. Our office does a business program. And we see businesses, everything from Merck, which is a worldwide corporation, which soon will be here in Union County, to small individual mom and pop shops. And last year, Merck and a window washing company met and they were able to work together. So I think there's plenty of opportunities to work together with using this diversity. I think also one of the things that stood out to me was the need for the safety net security. We have plenty of families that are working, but they're still below the poverty line. Or they're working and they still face these challenges. And oftentimes, I know with our programs that come down from the federal level, we can't help them. And so building partnerships with other organizations, schools, to help these families that might seem to be okay on paper, but we all know that they're not. I think that's something we really need to work on and capitalize on.
Yes, good morning. I guess my first aha moment was the fact that this needs assessment was done. And then I go to what's new here. Because we've all experienced this over many, many years in different parts of the areas that we choose to serve children and families. I think I would first early on offer a little challenge. I had a colleague, he and I were at a conference on the West Coast a few years back, and he was a keynote speaker, and he was to talk about the state of child welfare, if you will, with the group. And he came forward and he said, you know, I've been asked to speak about 30 minutes or so about the state of child welfare, and I can really do this in 3 minutes. And the reason I can do it in 3 minutes is because we already know the answers. And what we really need to focus on is the political will, the small p, the big P, but you know, let's get it done. Because the answers have been there for many, many years and many, many studies. And while I think there's a positive here in this study that it updates the state and the conditions in Union County, the challenges and opportunities, but where do we start digging the foundation and building on the positives in the community and going forward? And so my aha moment was, okay, we have a needs assessment, and that's a good thing. So where do we go from there? Then there are other thoughts that I took away from the study early on. One of the data elements that stood out for me was the fact that the focus on the communities of concern are here again, as they were in 2007. And I guess I would say, was there anything anywhere to show what changed between 2007 and now for those communities of concern? The other thing that I didn't see, and maybe this was not intended in this study or this portion of the activity, is some discussion of resource assessments and asset assessments connected to the findings that are pretty clear to all of us, I think. I'm not making light of this study at all, and I know there was a lot of work that went into it, and I would commend Jim and all those associated with it. But I think you need to look at how do you also identify the causes, also identify the resources that are already available in Union County and the things that need to be here in Union County to move forward with some of the recommendations. The study itself, Jim asked me, did I review the study? And I said, actually so much that I ended up taping pages back together in the book because they came apart. But I thought it was a great effort. But again, I think, again, I'm not making light of this, but you could put any other name of any other county on the cover of this, and we know the similarities are there for us in the state of New Jersey and this country as well. So that's kind of my take on the aha moments early on. Thank you.
Good morning. You know, like Junius, I want to echo that when I read the study, really what I see is tremendous opportunities. I mean, in fact, I was enthusiastic last night, so I went over the material. So what I see here certainly is challenges. However, I see more opportunity than challenges, especially because I've been fortunate to work with some of the stakeholders in the county, and so that's a great hope. So there's two areas, again, there's a lot of material here that offers a baseline, and again, tremendous opportunity to move forward. But there's two areas. There's one under demographics and the other one under income. They jump out. And the first is in terms of the growth of the Hispanic Latino population, which is it's just drastic. And so the first trend is that there's a higher risk of being low income, and so require a greater array of services. And so that becomes really important in terms of how do you create the conditions to open the access to all those services for those communities. The second one is under the area of income. And there's a couple of trends that emerge from the analysis. One is that the economic downturns and the high cost of living really equals to many stressed families. And so the continued high unemployment, stagnant incomes, and the high cost of living really is bringing the level of stress to many of those families to a level that we haven't seen in the past. And so there's a need for services to help families deal with these pressures. The other trend that I just jumped out, and again, tremendous opportunity. Families headed by a female householder with children under the age of 18 had the highest poverty rate within Union County, 34.5%. That's striking, and again, tremendous opportunity. In comparison, the poverty rate for married couples in Union County with children under the age of 18 is 4.6%. And so statistically, it just provides tremendous opportunity to see these two areas under demographics and under income that we can really develop. And I believe there's a vision here in Union County that I'm really excited about, that is how we work and support that vision and bring it into reality. And I think we'll have the opportunity to have a conversation about that.
I'll be brief. So I want to echo the comments and concerns of my colleagues, and I want to lift up what I think are two really powerful opportunities as it relates to the work that we do in the state and in my office in particular. And that's one, the power of the geo-mapping, and really, as one of my colleagues mentioned, really being able to pinpoint communities, in some cases neighborhoods, and how powerful it is to really focus on where some of the needs are or may be, but also to parlay that as an opportunity to incorporate the actual voice of young people. And so that's really, my office focuses on the experience of adolescents and out-of-home placement involved with the department. And so really, hopefully looking for ways in those targeted communities where there may be greater need to incorporate the voices of young people who may be impacted or affected by those services or by some of the exacerbating needs. I noticed in the focus group portion, there was an agency that does a lot of work with our department that was represented, and for me that's a really exciting opportunity to continue that conversation. So in our office we often say, for young people, nothing about us without us, and so really trying to figure out ways of having young people at the table to help drive both the data collection but also the analysis.
Great. Thank you all for insightful aha moments. We're going to move to individual questions for our panelists. When you guys registered this morning, you should have received an index card. If you have questions for an individual panelist, if you can please fill it out while they're answering their questions, and our United Way staff will pick them up, and we will try to get to as many questions as we can at the end. Thank you. This question is for Ms. Belin-Pyles. There is a greater level of diversity in the families attending the schools. A good section of children who attend schools have parents who might be linguistically isolated. This is a phenomenon that's pretty reoccurrent in urban education settings. What are some of the strategies that the school system has adopted working on or access these groups and parents? What types of family-centric efforts are underway that can be replicated by similar type of school systems?
So I know I'm going to sound like a commercial because we're a district that has a family success center within the district. And part of that is a partnership with not only the United Way, but human services as well. And so understanding the importance of a holistic model, providing services, locations where families can actually come in. We also have programs that offer English language learners for parents, and evenings offer courses where we're partnering with local community providers. We have launched programs that are called Education for All tutoring programs, where it doesn't matter of your income or your economic status. We're opening the door where children can actually, and families can actually see the support that's necessary. As many school districts in the county, we provide our materials are translated both English and Spanish throughout. We have made concerted efforts in terms of our hiring practices to increase the diversity of our population so that our employees are more diverse and are able to better service our students. We have not only provided professional development for our staff, which is very important as well. We're strong partners with the local city of Plainfield, and so we pretty much open up our facilities for not only the city, but other community-based organizations that have missions that are aligned to the Plainfield Public School mission, and so that provides opportunities to utilize our facilities to provide services for our diverse population. And so we're pretty much necessarily a holistic approach, so we're willing to do whatever's necessary. We work very closely with the Plainfield Health Center to provide wellness physicals for children, so to remove that barrier of families who are undocumented in terms of being able to have access to healthcare services. So that's part of our built-in agreement with the health center as well.
Are there any other trends and issues that you may see?
One of the trends that we're facing as a district, I would say perhaps early on, maybe 8 or 10 years ago, our population in terms of our Hispanic population, in terms of geographic location of where they resided, has changed. We have more families that are coming from rural areas. We have older children that are coming into the district. So it's not uncommon to see someone entering at the age of 17. And so we have to provide services to meet their needs, to assist them and support the children so they'll be able to graduate from high school, which does negatively impact our graduation rate. That's the commitment of the district. And I say that I try to make the context to bring it all together because we hear these things, graduation rate. And I want to say this for all urban areas. I mean, there are so many things that's built into that. And so if you have children that are entering into your school district later in life, they're not going to graduate in that 4-year course. So automatically your graduation rates go down. If you have a high population of disabled students, special needs students, and you provide 5-year graduation plans, your graduation rate is going to go down. And so all those kinds of things you have to be aware of in terms of your planning and support. And you really have to make a decision, what is going to be most important to you as a district, as a community. Are you going to focus primarily in statistical numbers, or are you going to provide the types of services that children and family need? And those are the kinds of things we have to focus on.
Thank you. The next question is for Dr. Renee Wilson-Simmons. Educational disparities become apparent amongst diverse students at a very young age. Without going into various contributing factors leading to these disparities, what are some initiatives that you are involved in to minimize these disparities? What are some of the best practices that you would recommend to replicating in our communities?
Well, I will try to make my answer short. And it relates more to the work I did prior to coming to the National Center for Children in Poverty, because I just joined as its director in October. But in my previous role at the Annie Casey Foundation, the foundation's focus is on improving outcomes for vulnerable children and families and working with public systems to improve the way they work with families so that they're doing a better job at working with families. The problem was that despite the fact that the foundation was funding lots of programs and initiatives and could, for instance, for our Juvenile Detention Alternative Initiative, we could point to, I think at this point, 40 states that actually have reduced the number of juveniles in detention. And intuitively, we'll say that they'll have better outcomes. But we were only tracking numbers. So that young man and young woman was diverted from detention, but where did he or she go? Where was he diverted to? What program was he involved in? How long did he or she stay there? What were the outcomes? So we weren't tracking individual outcomes, we were tracking numbers. And so 3 years ago, we changed the way we were operating and said, we need to see what kind of impact we're making with these dollars, as opposed to saying we're reaching many states and many people. So an evidence-based practice division was created that still had its focus to improve outcomes, but also to develop a new framework to guide public investment in programs that are proven to improve children's health and development. And so that meant identifying what we were talking about in those areas. So we identified prenatal, early childhood, middle childhood, adolescents, and young adults as our age group. We identified the kinds of areas where the focus needed to be: education and skills attainment, positive relationships, emotional well-being, positive behavior, and physical health. And then we worked to identify the kinds of programs that had proven outcomes. So it couldn't be promising. So we started by looking at all of these databases that currently exist, and then looking at our programs, and like 2 of them were in one other database, and 4 of them were in this one, and there wasn't, and the criteria were so different across them. So what we ended up doing, and now the initiative is being piloted in one city in Providence, Rhode Island, was to identify the programs along those domains that have strong outcomes. They have a randomized controlled trial, which is the gold standard, or a quasi-experimental, which is the second level, and what kinds of outcomes needed to be, at what level were the outcomes, and for whom. A lot of times you hear about a program, it sounds promising. Well, was it used with that racial or ethnic group? Was it effective for girls as well as boys? So what the foundation is trying to do is answer all those questions so you can go to a database, find out the kinds of programs that have been implemented and have shown to be effective for what racial and ethnic groups, for what genders, and at what cost. And then how we can use public funds in order to actually access the dollars in order to implement and sustain the program. So I think and we looked across the nation about the kinds of work that's going on to be able to pull from that and to actually contact the developers of all those programs. And just one last thing, often you'll hear about a great program, you'll be searching around trying to find the information about it. You finally find it, but there's no training, there's no technical assistance, there's no manual that you can use. So anything that's in this database has to have all of those. And you can go in and you can do a cost-benefit analysis of what the cost is per child and what the outcomes have been. So I think those are the kinds of things we need to do. We can't just hear about a good program and it sounded really good and run off and try to implement it, or develop a program on your own without a real model or a basis in theory and practice. So there certainly is that work going on, and I think those are the things as next steps that we need to look to.
The next question goes to Kelli Puryear. Provided that a good section of the youth population is disconnected, what is the state doing to address the needs of this population that can be replicated?
Thank you for the question. So I think first thing I want to just kind of change the language of the question a little bit. So it's framed in terms of young people being disconnected. And I think the reality of our practice is that young people are connected in a lot of ways, oftentimes to a lot of systems. And so a lot of the opportunities and challenges really lie in identifying those systems where they touch each other and looking for ways to collaborate across agencies, across departments, whether that's state, county, and local. But also, again, this is kind of the drumbeat of the work that I do, is really inviting young people to help drive those conversations, to really help figure out ways of improving services and opportunities for them in ways that are meaningful to them. I think we talk about as professionals and adults, we talk about positive programming or pro-social behaviors, but it's been a while since some of us have been adolescents, and so really looking for opportunities for the voice of current adolescents to really drive our work and really enforce those connections where possible to prevent them from being antisocial or not productive to being pro-social, but also looking for ways of connecting peers. So we tend to sometimes in our work with young people who are interested and engaged, and those are really great opportunities, but using that information to identify young people who maybe aren't as well engaged as we would like, and again, looking for ways to incorporate their voice and their experience, and to sometimes giving us hard feedback about things that we're doing well and not so well, and looking for ways to track and adjust that.
And a follow-up to that, what are some of the youth-centric goals that we as a community need to be aware of and align with other resources that you're currently involved in?
So I think my colleagues at the panel, and we've been at breakfast this morning, talked a lot about the services that we're offering. I think the schools are really a key opportunity. Most of our young people spend most of their time in schools, and so looking for ways to support schools, family support organizations to really create opportunities for families to come, to get help, to get services, to connect well with adults as well as with each other, and really help to strengthen their experience. We talk about youth-centric services, but young people exist inside family systems that exist inside communities, and so I really think the opportunity is to really look for entrees into those families, into those communities, and ways to strengthen that will also benefit you.
Wonderful, thank you. The next question is for Dr. Rodgers. As an economist, Dr. Rodgers, you deal with the numbers all the time. You're very familiar with the poverty statistics and the plight of the working poor. Given the stressors that working families are facing, what can we do? Given the fact that unemployment rate remains high, what strategy should be considered to ensure that families have access to the necessary resources?
How much time do you have? I covered this question in a semester. Advertising over 3 come take on board. So that's a very, very important question. And I guess there's 2 ways I kind of think about this, and I've been thinking about it in a lot of my recent commentary or communication with publicly. And I think most of us in this room are old enough that we remember the frame oil filter commercial. Remember that? What was the phrase? You can pay me now, you can pay me later. And I frankly think that we are, as a nation, we as a state, as a variety of counties here in New Jersey, we are really facing that dilemma with regards to, do we want to continue to sort of disinvest or slow down our investments in what the United Nations calls human priorities? It's not just education, human capital, it's also social capital. It's investing in community centers, it's investing in parks, it's investing in after-school programs, simple backpack programs that provide food for children and their siblings over the weekend. And the other piece of this, along with this sort of you can pay me now and pay me later, another way I like to frame it is, we are truly at a fork in the road. We are truly at a fork in the road, and decisions that we are making today, whether it be at the federal level with regards to the budget, whether it be at the state level with regards to budgets, and local levels, it's going to make a major impact on which fork of the road we take. And now, the trade-off, the economic trade-off is, yes, we may balance budgets today, but I firmly believe that we will be increasing the need, increasing the amount of expenditures we're going to have to make in the future that will dwarf deficits today. These budget deficits are in dollars and cents. The deficits we're going to be seeing if we don't make the right choices are going to be, yes, dollars and cents, but they're going to also be manifest themselves in lower productivity, even less connectedness, less fewer people feeling empowered, fewer people feeling they have agency in making decisions about their lives, about their children's lives, about their parents who will be moving into retirement, and even their working careers. So with that preamble, what do we do? We have faced some major challenges. We've just come off, they don't have to say it, right? Remind you, the Great Recession. But the other underlying trend that also is it's impacting us continually is the globalization in information technology. Right? They have really changed how we work, where we work, when we work, and with whom we work. And yes, those have created a variety of benefits, but they have also generated a tremendous amount of cost for our communities. And so my kind of way I think about the economy in terms of policy, in the role of policy, in terms of the worker side, human capital side, as I said, is investing in human priorities. Whenever we slowed down our investments in human priorities, we did that in 1980, and we did that from 2001 to 2007. What happened? We saw a dramatic growth in income inequality. We saw a hollowing of the middle class. We saw the families that were above poverty, but not affluent. We saw them do much worse. And some of my work, and I mentioned it, my colleague Stephanie, who's out, Stephanie, please raise your hand. Because she's the one who really did the number crunching and helping us develop the narrative. We created a family or household called ALICE. And ALICE stands for Asset Limited Income Constrained and Employed. In New Jersey, we estimated 1.1 million of our households, or about a third of our households, fit ALICE. And a small portion of them are those families or households with poverty, but the remaining are families who are above poverty. These are families of four who may have incomes in the $50,000 to $50,000 range. And they are one job loss, they are one sickness away from being pushed into poverty. So how do we hedge against that? Against investing in young people's futures, for those parents who've lost their jobs or who are working part-time and want to work full-time. Because that is, we have a 9.5, 9.6%, I'm sorry, pardon for pun actually. We have a 9.5, 9.6% unemployment rate here in the state, okay? And that only includes those people who are actively still saying that they're searching, they're looking for a job. When you do, they don't construct this for the U.S., for the state, but when you look at the U.S. number, it's 7.7%, but when you include those who are working part-time, but want to work full-time, when you include those people who stop actively searching, but will take a job that was offered, you have an unemployment rate of about 14.4%. Okay? So we're at 9.6%, extrapolate that out. We're probably 15 to 60% in terms of what we call a real unemployment rate. So yes, we have to invest in strategies for our youngest people, but they have parents. And we need to make sure we're doing the right thing in terms of education and training and providing them opportunity. The other very chilling aspect of this for us is that in our report that Stephanie did, we released back in Labor Day, we estimated ALICE population estimates for each county, and roughly Union County is roughly the same as the state. But one of the most disturbing or challenging results, or a piece of evidence that we found in that report, is looking forward. We've talked about wanting to provide better jobs, better opportunity. The employment projections suggest that Union County's job creation over the next 10 years, I think about 2/3 of those jobs are going to be low-skilled occupations. Low-skilled occupations, right? So from a labor demand standpoint, we have to rethink our economic growth and our economic development strategies. Right? This report that Jim and his colleagues in Rutgers have put together, this report has to be transformed in a way connected to economic growth and economic development. Workforce development, as my colleague John Heldrich used to say, is economic development. It's economic growth. If we're going to improve it. And third, institutions become so important. Being strong advocates for raising the minimum wage. And not even just, well, we have to debate it every few years, but indexing is a good idea. Take increasing minimum wage off from being a political football. It's negotiated around tax credits. Indexing, so it's not a political conversation. Right? childhood tax credits, EITC, or income tax credit, these are all important things. What can we as United Way do? What can we as agencies do? We need to make sure that individuals who are eligible for these programs, these supports, have access to information and that they're getting these credits. And then finally, and it brings us back to this report, that we are in an environment, I think, that was started in the 1980s, where there's this belief that the government can't spend your money better than you can. That if you have a job loss, you've lost your job, or you're not earning to your potential, whose fault is it? Whose fault is it? Right? I'm not saying we believe that, but there's a general consensus, a feeling out there, this undercurrent, that it's your fault. And so this report, or your next report, Jim, has got to be a report that helps people get the aha moments that we have here. Okay? That talks about, well, what are the consequences for Alice who lives in Union County? Okay? What does it mean for Alice to not have child care, access to child care? That was one of the main things. But not only just for Alice, but for the community. I wear this pin on my belt, Live United. I wear it with pride, because what we're trying to communicate is that we are not little atoms or little economic sort of micro agents, right? That sort of we once in a while we bump into each other and we have exchange. But we are tied to one another. Our county, Somerset County, we are tied to you all. Why? New Jersey, we have some of the most complex community patterns in the world, and the density points you raised. So use this report as that way to take us that next step in the county of how we advance the common good. One of my old advisors, when I was just beginning to do my doctoral work, Michael McCarthy used to say to me, Bill, it's no good to have your neighbor poor. Right? And simple statement, but we lost that. Right? So part of this drumbeat, this next report, has got to help people in your community understand not only the consequences for Alice or for your Union County residents, all your Union County residents, but it's got to understand that these people, that you are tied to these people. There's many people, Alice, I could ask you raise your hand on your way to this meeting today. How many of you stopped and got coffee? If you did that, you were interacting with Alice. How many people dropped off a child at a daycare center, child care center? You interact with Alice. How many people you have elderly parents who you're getting help from? You're interacting with Alice. These people have the same values as you, but that's something we have to communicate to the broader public. So, sorry about that. I'm not sorry. I'm not sorry.
Okay, the next question is for Cherron Rountree. What strategies have been adopted by the Union County Workforce Investment Board to ensure that residents are job ready and the need of the local businesses are aligned with the skill sets of the residents? Are there currently any job training programs in place for low-skilled, underskilled, unskilled residents? Can it be shared with the group? What is a wide discrepancy in the skills gap, skills shortage? What can we do collectively to ensure well-being of families?
Many parts there. Dr. Rodgers just spoke about investing in human priorities, and I think that can't be better said. But we want to make sure that we invest in the correct and the right priorities and the areas that are growing. So our office handles the economic development side that you're referring to. So it's an honor to be here and to be speaking with everybody, looking at this report and taking it and propelling it to what our office does and to doing workforce development and workforce outreach. We've been looking a lot at industries that are growing, and the state has been looking at industries that are growing. And they've identified 7 throughout the state, but we've narrowed that down to 3 in Union County. The first one is healthcare and the healthcare industry. As I mentioned earlier, in 2014, Merck is moving their worldwide headquarters here. We have 2 huge major hospitals. We have countless doctors' offices. We have nursing homes. The population is aging. Those jobs aren't going away. We need to develop programs and create programs for people to get trained in that industry and to serve doctors' offices and nursing homes. The second area is TLD, Transportation, Logistics, and Distribution. Here in Union County, we have planes, trains, automobiles, bicycles, boats. They're opening the Panama Canal and raising the Bayonne Bridge, which means larger ships are coming into Union County. We have one of the largest ports in the country. A lot of people don't know, part of Newark Airport, major airport, is right here in Union County, Elizabeth. It's not only just Newark. We have trains, freight trains, we have passenger trains. How can we get goods and services that are created overseas out to the rest of America, and it comes right through this region? So we need to start training our workforce on how to do that. It's not just driving trucks, it's going into warehouses and managing warehouses. And you start at one level and you can continue to move up. So we really want to focus on training people in that area. And then the third is retail and hospitality. That's something that cannot be outsourced. Everybody wants to go out and grab dinner every once in a while. You have to buy clothes. And those industries, you can start at the ground and work your way up. So the County Workforce Investment Board is focusing our funding in those areas. And we're really excited to start our Union County Choices program this year. Our Heldrich chairman announced it. And it's using those three areas and putting cohorts of individuals through classes, partnering with Union County College to get national credentials. So they can get trained here in Union County, and we hope they stay here, but they can take those credentials that they will get through our programs and move them. We're going to kick off with the healthcare because it's a longer program, but we are combining what normally takes a year. Individuals will get trained in EKG technician, medical office billing and coding. That process would normally take a year. We're going to shrink it down to 4 months and train people to get on the streets. And these are places where they'll get jobs. And in the next month or two, we're going to roll out transportation, logistics, and distribution, as well as the retail and hospitality. So those are areas that we're really trying to focus individuals. It's everything from our young people who are still in high school and letting them know that these are areas of growth to people right now that are looking for the jobs.
Okay. Another question. In this current job environment, what do you see are the best opportunities for youth transitioning to adulthood employment opportunities?
Well, I think focusing individuals, wow, this one's louder. Focusing individuals on these areas that are growing. It's great to have a choice, but if you go into an industry that there's no growth, at least not in this region, you're going to find individuals who go through a program, go through higher education, and have nothing to do. So I think teaching individuals, I know a lot of the jobs that I'm learning about now through our Workforce Investment Board, I didn't learn about when I was a high school student or even a college student. So I think letting our young people understand that these are areas of growth where you can get in the front door and work your way up. Some of the most impressive people I've met are in these industries. And I think as mentioned in the study, and I hear everybody speak about, after school and summer job training programs, actually exposing our young individuals to these industries, which they might not know about. And we can do that in partnership with various organizations in the county and the businesses who are looking for trained people. There are plenty of jobs out there. We just don't have people trained in the right areas. So I think teaching children and our young people where they can go and actually get in the door and then work their way up, because anybody that wants to work hard should be able to move up.
Thank you.
I think it's just several cautionary notes. And I think one is it's very important for us to maintain this balance between just putting people into jobs and versus helping them think through careers. And I think at the end, you brought that point out that this is, yes, there is this notion that we have almost 10% unemployment rate, real unemployment rate is probably 14–15%, so, and it's been going on for a number of years. That's a point well taken. But just as many of us in our United Ways, we were trying to promote community impact. So promoting occupations that provide living wages, that provide a career ladder, that some of us have slipped back and wanted to do direct impact and respond to immediate needs. So just as we move forward there, the other piece, I think there's an opportunity for, there seems to be evidence that supports it. Another area of jobs that can't be outsourced are HVAC technician, auto tech, and a former school board member who was on a board of a career technical school. I understand the challenges and the politics of getting parents to wrap their head around putting their kids into that kind of opportunity. But I think we now target opportunity because of people are looking for more security and in terms of opportunities. And so I would love to see us put more emphasis on career technical opportunities, particularly in the trades area. And starting with one of our first observations about Union County in its racial and ethnic diversity, cultural diversity, we need to not only make sure we're providing training, but we need to make sure that we have fair and safe workplaces. And that we also remove the geographic barriers that individuals experience in terms of trying to get to the jobs. My students, one of the first projects I did when I came here, we looked at the port, when the port was beyond just the actual water port, but it included the airport too. And we were trying to understand what were some of the logistical or geographic barriers or physical barriers that individuals face in terms of trying to get to those jobs in Elizabeth. And one of it, some of it was centered around race and discrimination, but others, a large part of it was, I think at that time, you had to, if you wanted to get to the port for a job, it started at 9 o'clock, you had to be downtown at the bus terminal by around 6 or 7 o'clock in the morning. And I understand some of that's been addressed, but this is a very common thing we call spatial mismatch. And it can explain a major role in some of the differences in employment opportunities we see. So I love the idea of the progression of the training, focusing in on the areas of the fastest growing and largest growing, but we also have to make sure that we're doing some holistic approach. And, making sure that the workplaces are fair and safe, and then also thinking about these occupations that many parents don't think are sexy, but they provide a very safe and secure and lucrative career.
Thank you. The next question is for Antonio Lopez. What are some of the opportunities to maximize prevention in partnership with DCF to support families in Union County?
Well, that's a very good question. In fact, United Way and the county and other key stakeholders in Union County have a framework, and it's the Families Network. And basically, we, the department supports that type of work because this is based on the family success approach. I'm happy to share with you that we are very unique in the state that we have what we call a family success movement. And it's how do we approach family, how do we engage families wherever they are. And so based on that, it becomes really important for the work that has been initiated in this county, in that there has to be holistic family success networks to be developed in a manner that reflects the needs and aspirations of parents and families. And so that's critical. Our experience shows, my experience, the field experience and research, that most of these families, right, and the report shows that most of the families will be hesitant to knock on the door of a social service agency unless they are in crisis. And so when you look at this report, right, and some of the things that I mentioned already, that we're talking about hundreds of thousands of families, they assume if there's not an intervention where they are, we will be facing a situation where we'll be dealing with crisis. And so we certainly, the department, our division, is working closely with the county in terms of supporting this Strengthening Family Network, which is building those local networks based on the family success approach. And basically for those, and I believe that there's some of us that are very familiar with some of the Family Success Center and the high success that we're having. And people ask me, I said, what is it? Well, basically the Family Center helps families regain their ability to dream again and envision a better life for themselves and their family. And so if I want to give you, and it's how, families are approached. Families are approached as partners, as clients, as consumers, but as partners. And so what I believe that you're building here is really critical. And this is why I alluded earlier during the first question that we have tremendous opportunities here to really effect change. Because we need to take a look at the aspiration of our families and our communities. And they should be guiding us as to what they are. And so I'm very optimistic about the work that's been done here.
Thank you. The next question is for Dr. DeKlyen. The needs assessment does point out the racial and the income inequality across the municipalities in Union County, leading to the fragility to families. The underlying factors are many and complex. However, what can be some of the migrating policies that are working in other municipalities and initiatives?
Well, I think some of them have already been addressed here, and I do believe that you have to address every level. That you can't sit back and say, well, this is the one thing to do. And so, working on job availability and for people building skills so that people have access to those jobs. Certainly, the school system, and I was delighted to hear that Plainfield does have a holistic view, so it's not just looking at, well, do our kids have their academic skills, but really recognizing that the children need to have all of their needs met, as do families, that you have to look at it all. I would, as I suggested before, I would really emphasize the importance of beginning very, very young, beginning from birth, in fact, if not before. That, as I mentioned before, that just financially for those evidence-based programs that have been studied carefully, it's clear, and it becomes clearer as the years go by, that these more than pay back what you spend on. They more than reimburse society for the costs that they put in. But in addition, we really can't hope that children are going to become as proficient in school as we want them to be if they start school at the disadvantage that they start. And there have been studies, you've probably seen these because they've been pretty well publicized, that indicate that by age 3, the child of a welfare mom typically has heard a third as many words in their lifetime as the child of a professional mother. From the very, very beginning, the children who are born into poverty and at very low income have fewer of the kinds of supports that they need in order to begin school well prepared to learn. I would say, I mean, we are all familiar with the sort of the cognitive aspects of this. I think what's been not attended to as well as or acknowledged as much as it should be is just how important the social emotional growth is critical, and especially in those first 5 years. So that when I shuddered when, for example, Head Start started looking at what are the pre-academic skills. We're going to judge how successful our programs are because we know from the longitudinal research that many of the outcomes of programs like Head Start have to do with, do these children finish school? Do they graduate? Are they as likely to go on welfare? No. Are they as likely to have a criminal record? No. That there are those social things that make people successful in life, that early intervention makes a big difference in. So looking at that aspect and some of the sort of, to me, exciting new research that really highlights the importance of our looking at communities. And I was delighted to see that violence was placed under the heading health because it very much is a public health issue. Some of the exciting new research is showing just how important a negative factor stress and trauma are in cognitive development, in health. That children who are exposed to the trauma of violence in the home, violence in the community, disrupted families, all those kinds of trauma that are all too familiar in many of these communities, actually have different different cortisol, blocking on the word there, metabolisms, which cortisol is how we deal with stress. It has a lot to do with how we deal with stress. It changes how that happens from the very early stage. It changes their immune capacity. It appears to change brain structure. We see differences in the hippocampus, which is so critical for memory. So we are learning increasingly that we're putting our children at increasing risk when we allow them to be subjected to the kinds of trauma and stress that violent communities, that impoverished communities, that communities that don't have social support networks. And I certainly, one effort in that direction are the Family Success Centers, which are really an effort, along with extended school services, to embrace the whole family, to provide social supports. So I'm not sure if that's exactly a program, but I think it indicates some of the things that we need to address.
Thank you. This question is for Junius Scott. What do you see are the tactical changes in the funding priorities in the world of child welfare? That's a smile.
Thank you. Well, sequestration aside.
Yes, I remember.
Let me start off with a little preamble as well. A year ago yesterday, our Children's Bureau celebrated its centennial. It's the first federal agency, in fact, it's the first in the world of an agency that was exclusively dedicated to serving children and families. Our focus will continue to be on safety, permanency, and well-being for children, and well-being for the families that those children live in, or that we would like them to live in. But we have been thinking and talking and meeting with people in the field about approaches to how we look at safety, permanency, and well-being for children. And so I go back to the Brown Orphan commercial because I really think it's so important. And unfortunately, I think in the masses of our society, we haven't gotten it yet. But if we do the supports in the front end, because here's the fundamental question. It's not a matter of whether we pay, it's when and how much. And if we do the supports in the front end, we stand a better chance of determining when and how much. Because at the back end, we have less of a chance to do that. So those are important things to understand and remember. So our conversations of late have been around front-end supports. And while there's not in the big picture a ton of money under the umbrella of prevention, we are looking at ways in which we can do the front-end supports, prevention if you want to use that term, to assure safety, permanency, and well-being for children, and thereby hopefully build in some measure of how we strengthen families, strengthen communities. One of the things that we found throughout our round 1 and round 2 of child and family service reviews that we did with states was the fact that there was not enough family engagement, real family engagement on the road to how do we help the family, how do we strengthen the family, how do we prevent removal of children into foster care and so forth. And so we've kind of gotten that now. And we've gotten that in partnership with our states. And New Jersey is one of those states that has reflected, the light bulb went off and they're doing great things in terms of engaging families because it's terribly important. And it's more important after, if they in fact end up in a state child welfare system, it's even more important that we engage families. So these front-end supports would be where we are looking at where the resources should be going to strengthen families, to protect children, assure that they stay in permanent and loving families. One of the other things that we have learned is the value of data. And this needs assessment in Union County is a from or filter moment. And I hope that we fully take advantage of it, because this needs assessment tells us that we do need to pay now and not later. So we have in the Children's Bureau recognized the value of data, but we've also recognized that there's a need to understand how to gather the data, how to analyze it, and make it useful and effective. And right here in New Jersey, I'm proud to say that we supported a management by data project with the Department of Children and Families, whereby they have begun to look at data that they gather about families, about communities, and so forth, in ways to help them make better decisions about funding, supports to families and children, and practices and so forth. So let's first and foremost recognize that there is great value in having data. And then secondly, there's great value in how we use it, understand it, and make it work for us. We have on our Children's Bureau website tons of information about states and data about states and children and so forth. And so I would hope that you would go visit that, because again, I think it says where we're headed in terms of looking at resources going forward, and how we are looking at data as a way to help us make better decisions about serving children and families. The Child Welfare Outcome Report is a very good report about the state of child welfare in this country. And when we put together this report, we give every state an opportunity to respond to what our findings are based on the data that we collect from them. And this is New Jersey's comment. And I'll just read one of the comments because I think it's important to understand. And this is provided by the state. This is an official statement. Under the heading of performance, New Jersey continues to reduce the number of children entering foster care. That's important to know. The number of children who enter foster care in 2011 was 4,491 compared to 5,249 in 2008. In fact, children exited foster care, more children exited foster care than entered for the past 4 years. Additionally, exits to reunification increased by 7% since 2010, from 59% to 63% in 2011. So this is an important piece of information and data, because it tells you about what the state is doing, how it's doing, what the impact, implied or explicit, is on families and on children. And we've done other reviews in New Jersey around Title 4E and found clearly that this statement is supported by the reviews that we've done as well. So data truly is important, so let's not lose the value of that. So those are, again, from our perspective, the kind of supports that we will be looking toward going forward. And I guess the last thing I want to say is that we are also continuing our Title IV Child Welfare Demonstrations, which is another opportunity for states to look at how they provide services to children and families who experience the child welfare system, give states some flexibility and an opportunity, again, perhaps in this front support approach to serving children and families. So that's still an important piece of our agenda.
Thank you. Now, there's three more questions. These questions are for Dr. Rodgers, Dr. Wilson-Simmons, and Dr. DeKlyen. The cycle of poverty is intergenerational with negative effects on every factor of life. The poverty issues are localized and neighborhood-centric. What is currently underway to mitigate this issue? Can you share some of the implementation strategies?
And I will be very brief. My response is partly a request for a different mindset about the way people think about what's going to work. So, we hear violence prevention programs, teen pregnancy prevention programs, and dropout prevention programs, and drug abuse prevention programs. And we already know that there are limited financial resources to invest in programs. And that if we invest in programs, we want to invest in evidence-based programs. And that there's pressure to make the investments pay off because of the limited funds that are available. But we need to be looking at risk factors and protective factors. Self-regulation, parental attachment, poor family management, the things that across the board are the reasons that young people choose, and some of them do choose to become pregnant or choose to use drugs, so we can't continue to sort of compartmentalize and find programs that we think address one behavior, when in fact there's a constellation of risk factors and a constellation of protective factors that actually can be addressed in comprehensive programs. So that's one thing I would say. And the other, just because I know I won't get another chance to say this, and it might not even be responsive to the question, but it's in relation to some of what I've heard previously about this issue of political will, and also about sort of these negative perceptions of the poor. And we know that children do better when their families do better. But in this contentious political climate, there's an inaccurate and damaging belief that children are poor through no fault of their own, and so they deserve our support. But poor adults, their parents, are in the situation they're in because of the decisions they made. And they have to deal with their sorry situation. It's very upsetting to me, and we hear it all the time. And we know that without the connection to a caring adult, without parents who have the support to do the kind of work that will enable them to have the kinds of funds that would enable them to provide the kind of care and development for their children, we're all going to be in a sorry situation. So one of the things that our center is trying to do, and we're very hopeful about funding, is around a national campaign to sort of propel child poverty into the national agenda and change the vision and the beliefs that people have about the poor. Because I absolutely agree about this change in political will, but we have to change the public's will. Because the political will is based on the public's support or not of any policy. So again, I answered one of your questions, but not the other. But I think this issue of a different mindset and also a changing of our public will make a huge difference. Your name, but I just want to say that the Center for the Study of Social Policy, which is a
DC-based think tank that has an office in New York, actually has a framework called the Youth Thrive framework that may be actually helpful. And so it spoke to some of what you were talking about around shifting the conversation away from risk factors and really starting with promotive and protecting factors, and because they have a strong way of mitigating those risk factors. So I just wanted to give a plug. We're doing some work with the department with them. I think it's a great vehicle to help transition that conversation.
That's a good plug. We will be having community conversations, and they have agreed to be a part of it. So we will be bringing them to Union County as well. Dr. DeKlyen or Dr. Rodgers?
Yeah, I can go ahead. I'll answer your question in reverse order in terms of strategies. I think that what we want to move towards, what we want to move away from, are the fragmented way in which we have delivered services for decades and decades. The way in which we've sort of addressed one crisis, one problem, one catastrophe at a time, and said, well, let's go and fix that, and then let's go fix that. And so that, as you all know, if a family is in crisis, they end up having to go to 20 different places and fill out the same thing 20 times. We desperately need, as a strategy, an integrated way of helping, providing supports for families. And I had sort of a mini experience of that before coming to Princeton. I was at the University of Washington, and through the hospital there, when they had a program, which I hope is still in existence, but it was one of these things that was funded. You know, as we all know what happened when it's a great program that's funded, and 5 years later, sometimes it's gone. But essentially, for children in the system for whom their children's services program, the state program, was trying to devise a permanency plan and was having a great deal of difficulty. Instead of having a caseworker sort of go around to various people and they have evaluations done and so on, they brought all of us together, meaning they brought the caseworker, they brought, in my case, a clinical psychologist, they brought other social workers, they brought everybody who might be involved in that case together in a room to talk about what's going on. Why is it so hard to find a permanency plan for this child? And through that coordination, we were often able to come up with better integrated, better developed plans to, in fact, come up with permanency. In terms of programs at this point, I think that the kind of family success centers are definitely an effort to do that, to really provide a wraparound. I would argue that they are desperately underfunded, that you can't expect a couple of staff people to provide the kind of supports that we need. We need people who, need centers that are open in the evenings, on the weekends, when people are able to go to it. And we need more people in order to really provide the kinds of supports across all of these different areas. So that's one example.
So my reaction to your question is twofold. One is that we need to be careful here when we talk about the cycle of poverty. And maybe some of this research has been updated, but my sense is that from some of the best longitudinal databases we have, most poverty spells are not long-term intergenerational. They are short, right? Very short. Most poverty spells are short duration. That they stem from a job loss, they stem from possible domestic violence or an illness. And so, with that in mind, I introduce you to Alice, or talk about Alice at the state level, or 1.1 million families in the Union, are United in North New Jersey via Stephanie. We estimated that basically about 52,000 households in Union County are struggling, that they don't have enough to meet their sort of basic necessities. And only 10% of these, about 19,000 of these households, are living below the U.S. poverty line. So about 33,000 are falling below this ALICE threshold, which is again for a family of 4, will take up about $53,000. So let me connect my first statement about typical poverty spells to the ALICE population. So one of the things I'm very concerned about is that again, at the national level, about 40% of those who are unemployed, 40% of those who are unemployed, as estimated in last Friday's jobs report, they've been unemployed for 26, 27 weeks or longer. So many of these individuals were, what we like to say, cyclically displaced because of the up and down for wages of the economy. But what happens to an individual who has been unemployed for half a year, 3/4 of a year, what happens to their skills? What happens to their skills? Losing skills. What happened? And in this day and age, we have moved away from the sort of hard skills to what we call soft skills. And I maintain, or I think that the deterioration of soft skills, particularly in the service economy, are even much more detrimental. I mean, take some of our groups that are really on the tough ends, our ex-offenders, being released, simple things of we don't have a smile. Is an issue when we take that for granted. So what I'm concerned about in terms of this issue of poverty is, yes, we want to make sure we grow our safety nets to push people forward, but we are at a critical point. Again, my fork in the road banner thank you for taking up my theme. But we are at a point where we have a whole host of families, these ALICE families, who are truly at risk of potentially falling into poverty. That we've done in the past, we've done a real decent job of providing upward mobility, but we are now, as I said, in a position where ALICE and the other these families are going to fall into poverty, largely because they become now they move from being cyclically unemployed to being structurally unemployed.
May I just add something? Excuse me. Because I agree completely that poverty is not as intergenerational as we thought. So maybe we should change this from just being, we have to be concerned about poverty, but we need to be concerned about disparities of income. And we need to be concerned about the decreasing social mobility in our society. And those are overarching affect many more people in this country than does poverty per se. And many of the things that we're talking about address those issues as well.
And we have run out of time. But I wanted to thank our panelists for really coming here today and shedding your light. Thank you. I was going to invite Jim Horn back up for a closing, but join us on our community conversation because I see a lot of people are leaving, so we'll just make it quick. Community conversations are coming up. Please look out for it on your listservs. We will be bringing the experts back in the community, and we're going into the communities of concern: Elizabeth Hillside, Plainfield, Roselle,